Howdy, my name is Antonella Volpicelli, and I will be presenting how Apis propolis can be beneficial for people with type 2 diabetes. So to start and just give a little background, Apis propolis, sourced from Apis mellifera bees, is a natural resinous mixture of plant resins, bee saliva, and wax composed of beneficial products such as phytochemicals and antioxidants. Moreover, it is used to seal unwanted spaces in the hive when needed by bees. My question for this research is if, in adults with type 2 diabetes mellitus, could there be a therapeutic benefit of using Apis propolis for the reduction of blood sugar levels based on its markers, hemoglobin A1C, and fasting plasma glucose? So to start, what is type 2 diabetes? This is a disease that is characterized by insulin resistance and relative insulin insufficiency in the body, and unfortunately, more than 29 million people in the US battle with this disease, one that is actually a risk factor for many other health complications such as obesity, non-alcoholic fatty liver disease, hormonal and fertility issues, and more. For someone to be diagnosed with type 2 diabetes, these are the markers that doctors look for: hemoglobin A1C higher than or equal to 6.5%, fasting plasma glucose higher than or equal to 126 milligrams per deciliter, and the 2-hour postprandial glucose higher than or equal to 200 milligrams per deciliter. It is important to know that type 2 diabetes is different from type 1 diabetes, type 2 being one that can occur to anyone if not taking proper care of their health, and type 1 being an autoimmune disease. Now, before starting, there are 3 points to touch on: the role of A1C, fasting plasma glucose, and 2-hour postprandial glucose. So as mentioned before, A1C is a marker for diagnosis, but it is also an indicator of glycemic control because it helps understand how quickly will a food raise blood sugar levels after being consumed. Fasting plasma glucose is a measure of blood after you have fasted for at least 8 hours, and 2-hour postprandial glucose is a measure of blood levels after you have eaten in the past 2 hours. For the first study, we are looking at an 8-week single-blind randomized control trial with the interventions of either physical activity, Propolis, those two combined, or none, which would be the placebo in this one. Now, for this one, the participant group was of 60 women that were divided equally in the 4 categories aforementioned. And all of these women suffered of type 2 diabetes and dyslipidemia, which is a disorder in our lipid panel. As you can see in this chart, we have highlighted hemoglobin A1C and insulin. These two are the levels that decrease in the supplementation, in the physical activity, and in the 2 combined groups, proposing a beneficial effect on women that are looking to lower their blood glucose levels that suffer of type 2 diabetes. Now, for the second study, we are looking at a 12-week randomized clinical trial where participants were given either placebo or 900 milligrams of Propolis via 300 milligram pills a day. For this, it counted with 55 diabetic adults. Now, as you can see in the chart below, fasting plasma glucose and A1C both had a significant reduction in change in Propolis group versus the placebo group that had no significant reduction. Now, once again, it is showing that there could be a beneficial effect in lowering blood glucose levels and in the management of this disease by showing a decrease in these 2 markers. Lastly, this is a 12-week randomized clinical trial with a different intervention than what we were seeing before, of either placebo, metformin, which is a drug used to improve glycemic control as a treatment tool in patients with diabetes, and lastly, in this case, it was 600 milligrams of Propolis a day, where at the beginning we had 125 participants, but only 36 lasted towards the end, and these 36 were equally distributed among the 3 categories or interventions. So as you can see in this graphic, there was a significant reduction of fasting plasma glucose as well as 2-hour postprandial glucose levels, and one of the mechanisms that was proposed in this study behind the effect is that Propolis actually stimulates glucose uptake by our peripheral tissues, inhibiting the activity of the enzymes amylase, glucosidase, and maltase, which prevent the increase of plasma glucose after carbohydrate digestion, ultimately helping in having a better glycemic control and balance of our blood sugar levels. Nonetheless, it is important to note that, as you can see, the metformin group also had a decrease in the fasting plasma glucose and in the 2-hour postprandial glucose. And this is because this drug is meant to do that, but we are looking at other options and alternatives in specific natural ones, such as Apis propolis, to see if they could serve as a good therapeutic supplement. Once again, showing based on this study that it can for sure have some beneficial effects to its use. Lastly, this is an image that I found on a paper, and I felt like it was another good explanation on a proposed mechanism and how propolis could help with insulin resistance. So the way our body works is that our beta cells of our pancreas are going to release insulin once they have sensed that food has entered the digestive system by an increase in blood sugar levels. Therefore, our beta cells will get our insulin to start working and break down the glucose in our bloodstream, as mentioned before. But, however, people with type 2 diabetes do not have this ability, as beta cells, for them, do not work as good at either producing or releasing insulin, leading to that resistance and overall leading to that type 2 diabetes. However, this image that is based on animal and cellular models can help explain a little bit how some studies have found that propolis does help with insulin secretion and insulin sensitivity. So as you can see in this image, propolis can help prevent hyperglycemia by helping in the release of insulin from our beta cells that are either impaired, and then it can help to control or lower the hyperglycemia, which is ultimately going to lead to the management of this disease. As for the significance and future in medicinal use, the positive findings of Apis propolis in patients with type 2 diabetes can lead to a huge milestone achieved in the medical world, as this can be a good proposed alternative to drug use to treat this disease in patients that are looking for something natural, which even as a plus has the added benefits of antioxidants and phytochemical activity, which have many health benefits such as protecting cells from damage caused by free radicals and help keep immune systems strong and balanced. Now, as a conclusion, Apis propolis proves to be a beneficial therapeutic supplement for patients with type 2 diabetes in the terms of managing their disease by decreasing insulin resistance, therefore leading to a better glycemic control based on the markers that were studied in the articles presented, known as hemoglobin A1C, fasting plasma glucose, and 2-hour postprandial glucose. Thank you, and these are my references.